Today, our topic will be communal approach to public health, lessons learned, and best practices from partnerships with tribal communities. And we have several presenters today, Karen Armstrong, Michaelan Belgard, Nathaniel Brown, Ramona Danielson, Jacob Davis, Megan Dietrich, and Tanya Pershin. We appreciate them taking their time today to talk about this very important topic. In 2018, NDSU Extension was awarded a 5-year grant from the Centers for Disease Control and Prevention to address high rates of adult obesity in 2 North Dakota counties, Rolette and Sioux counties. In partnership with Standing Rock Nation, the Turtle Mountain Band of Chippewa, Prevent Child Abuse North Dakota, and the NDSU Department of Public Health, the Healthy Outcomes Project has been implemented using communal knowledge and a self-healing community framework. The team will talk about historical context, coalition building, and infrastructure development, as well as food sovereignty and physical activity strategies, including community beautification, gardening, and hydroponics. I encourage you to please introduce yourself in the chat, and as well, if you have questions throughout the presentation, to please include those in the chat, or we will have time for question and answer immediately following the presentation, so you'll be free to unmute yourselves and to ask your questions then as well. And I have the great pleasure of turning it over to the CDC HOP team.
Thank you, Andrea. All right, so we are collectively nervous and excited to share about our project with you today. I'm going to start with NDSU's land acknowledgement. And before I read the acknowledgement, I'd like to give some context that the recent movement around land acknowledgements is definitely appreciated. Acknowledging the history and peoples of the lands that we're on is important, but it is also controversial for many Indigenous people. An acknowledgement feels somewhat hollow if nothing is going to be done about it. And I will mention that NDSU has 2 USDA grants. They're called New Beginnings grants that seek to create an institutional framework that will not only offer tribal students the opportunities of higher education, but also provide a holistic support system to ensure their success. These grants have been able to fund the creation of a new tribal liaison position in the university with the intent to continue this position. And there's work to apply for more grants. So this is an example of some of the Native American initiatives that you can learn about at the URL at the top there. So I will read the acknowledgement. We collectively acknowledge that we gather at NDSU, a land grant institution, on the traditional lands of the Oshaty-Shakowin, Dakota, Lakota, Nakota, and Anishinaabe peoples, in addition to many diverse Indigenous peoples still connected to these lands. We honor with gratitude Mother Earth and the Indigenous peoples who have walked with her throughout generations, and we will continue to learn how to live in unity with Mother Earth and build strong, mutually beneficial, trusting relationships with Indigenous peoples of our region. So in terms of some concrete things that we can do, you can learn more about ideas of things that we can do to make land acknowledgements have some action behind them. And the Native Governance Center put together a great resource called Beyond Land Acknowledgement, and I have that URL there. And then our team here has identified you can donate to the Standing Rock Tribe directly at that URL there. And the example of a place that we can donate to at Turtle Mountain is the Turtle Mountain Tribal Arts Association, and there is that link there. I'm going to turn it over to Megan.
Thanks, Ramona. Good morning, everyone. My name is Megan Dietrich, and I am the program director for the Family Nutrition Program, SNAP Education. I'm sorry, I'm the program director of, I just had to switch my script over to the screen. Program director for the Family Nutrition Program, SNAP Education, and the Expanded Food and Nutrition Education Program with NDSU Extension. I'm also the PI for our Centers for Disease Control and Prevention HOP project. So as Andrea mentioned, in 2018, the CDC made significant funding available for land-grant universities to conduct activities within eligible counties for the High Obesity Program, or as we call it, HOP. Efforts focus on increasing access to healthier foods and safe places for physical activity, including activities that will reduce or eliminate health disparities related to nutrition and physical activity. So HOP is just one leg of a three-legged stool of CDC programs. The stool really has goals of improving nutrition and physical activity and reducing health disparities. SPAN is another leg. It stands for State Physical Activity and Nutrition Program. Gosh, all these acronyms. And that SPAN funds state departments of health. And REACH is Racial and Ethnic Approaches to Community Health, which funds community-based organizations and other entities. So all three programs have very similar goals and strategies, but not all states are funded for all programs. And currently North Dakota only has HOP funds. It is important to note the way that the RFA was written was really geared towards large 1862 land grants like NDSU. Requirements like only one recipient per state and the need for a local extension office in each target community essentially put the grant out of reach for our 1994 land grants, which are our tribal colleges, and also for 1890 land grants, which are the historically Black colleges and universities in other states. Throughout this presentation, we strive to be honest and open about inequities and acknowledging our privilege as the state's 1862 land grant is in that spirit. Eligibility was determined by counties with 40% or more of adult obesity, which at the time of application, Roulette and Sioux County, marked here with stars, were the only counties that were eligible. The map shown here is actually more current, and you can see a few more counties have approached or surpassed that criteria. The agreement we have with the CDC is a cooperative agreement, which essentially means we have expanded support and technical assistance from the CDC for our work. One key aspect of the grant is working with local extension. In North Dakota, we have strong local extension offices in Roulette and Sioux County, and I see a few of our county extension people on, so hi. So with this, we were able to leverage capacity, science-based outreach, and establish relationships in those communities for this work. The HOP program's overall framework is a social ecological model of health, which is pictured here in purple, a very simplified model. This model encourages community engaged partnerships to identify a comprehensive list of factors that contribute to poor health and develop a broad approach that involves actions at all levels from many entities to produce and reinforce change. While a lot of traditional extension work focuses on the individual level, things like conducting educational programs to transfer knowledge and skills, and the interpersonal level, creating and supporting community groups and activities like events and community coalitions and 4-H, the project objectives really encourage focus at the community and society levels. Sometimes we refer to the community level as the environmental level, and examples of work at this level might include community garden initiation, which Extension currently supports in many communities, including Roulette and Sioux, but also includes things like working with farmers markets to accept SNAP, or work with the city or county to enhance and promote walking trails, parks, and indoor sites where people can be active. The society level includes supportive policy changes like school district healthy concessions policies, or things like mandates for greater enforcement of bans on recreational vehicles on walking paths. All levels of the social ecological model are important, and long-term attention to them all creates the change and synergy needed to support sustainable improvements and healthy communities.
Thank you, Megan. I'd like to take a few moments to talk about trauma-informed approaches to working with communities. And as I've continued working in public health and on various health equity issues that I've been working with in my career, I'm finding that really any community that is experiencing significant health disparities is very likely to have historical trauma that is compounded by contemporary trauma. Historical trauma is a cumulative emotional and psychological wounding over the lifespan and across generations, emanating from massive group trauma experiences. This term was first used by Maria Yellowhorse Braveheart in the 1980s when she was talking about Lakota communities. Trauma-informed principles are quite consistent with a public health approach. They include fostering a sense of physical and emotional safety, and this is among our partners and with the community members that we're working with, building and maintaining trusting relationships, that community members are seen and recognized as the experts in their own lived experiences, that we level our power differences and share decision-making, building on community strengths and showing humility and being responsive to historical and cultural context. I find generally that even if you say, well, I don't think the community that I'm going to be working in does have a history of trauma, these principles are just basically being a good person and being a good community partner. So I think if all else fails, work from a trauma-informed perspective, and you might not even realize who you're helping, and it's not going to hurt anybody. So I'm going to turn it over to Michaelan next, and he's going to talk about some of the historical context within Indigenous communities.
Hello. As Ramona said, it is important to recognize and consider the historical context of tribal communities when addressing health disparities among these populations. Most importantly, to find the root cause of how the disparities originated. Each tribal community has their own history, culture, and story. Not one tribe will be the same as any other tribe because of these reasons. For example, the Garrison Dam wiped out the 3 affiliated tribes' land in the 1950s, and 90% of the population had to relocate. Talking on terms of Standing Rock, the Oahe Dam forced several members to relocate and flooded most of their lands. So for the last 500 years, tribal communities have suffered from adversities caused by the US government, and we take that into consideration when working with these communities, that a lot of their things have been taken from them, their population, their family, identity, and culture, causing lots of chronic illnesses and diseases and mental illnesses, and most importantly, poverty and lack of resources. And then continuing on with that, the federal government has failed to abide by treaties such as the Macomber Agreement, the 10-cent treaty that stole 10 million acres of land from the Pemina, or what is now the Turtle Mountain Band of Chippewa Indians, and White Earth Reservation. Turtle Mountain Reservation was considered too small to accommodate allotment for all members, and this was in 1892 that it was considered too small. White settlers had already settled on or near the reservation, taking most of their lands through land allotment. For Standing Rock, Congress moved the sacred Black Hills from their reservation in 1877. The US obtained nearly 3/4 of their land that was illegally stolen from broken treaties. And they divided it was once the Great Sioux Nation into 6 different reservations. The Dawes Act and the Land Allotment Act allowed for non-Native Americans to settle on tribal lands, creating checkerboards on all reservations and taking away resources such as waterways, land that was huntable to provide fresh fruits and vegetables. And the bison were purposely killed to reduce Indigenous populations, so they had no choice but to live off of rations that were provided by the government. Rations that contained preservatives such as carbohydrates, high fructose syrup, things that Native Americans weren't used to consuming, which really damaged their stomachs and gave them gluten allergies and lactose intolerance, and started the diabetes epidemic among Native Americans. Consuming all of these things that were processed, they were making them sick, and then leading to poor nutrition such as hypertension, chronic illnesses, cardiovascular disease, which is caused by diabetes and things like that. One fun fact I like to mention is fry bread. It's really controversial as to whether or not it's a traditional food for Native Americans. I would think not, because it depends on the timeline that you look at it. The reason why fry bread was created was because Native Americans had to make do with what they had from the rations. They didn't have very many resources from the lands that they were given to even hunt anymore or provide for their families. So they were forced to either start working and try to afford food, or live off of the rations, or what is now commodities that is distributed among them. Thank you.
Thank you, Michaelan. Jacob.
So, yep, due to this historical trauma, looking at trauma-informed approaches is an essential piece to examining and integrating trauma-informed principles, and that should be a necessity. And one way that we have done this within our work is through the use of a self-healing community framework. So our project seeks to improve access to healthy food and health-promoting environments using community engagement and culture as overarching strategies to reduce health disparities. The self-healing community framework that we use as the foundation within our work was initially introduced by Laura Porter, Dr. Anda, and Dr. Martin as a way to improve intergenerational health and social problems. Using this as our foundation allows us to create community design strategies to identify communal strengths and barriers. This process provides us the opportunity to create community-led empowerment approaches that are intertwined with communal knowledge. We are currently in the 4th year of the 5-year grant, have helped establish coalitions within each community to help us improve access to healthy and traditional food systems while also increasing opportunities for culturally informed physical activity. This process has allowed us to acknowledge the community expertise that exists within the communities we work within, which has also helped us support meaningful changes within those communities, while also meeting the objectives of the grant.
And so to start us off, I invite Nathaniel Brown to talk about the work that he's helping lead in Standing Rock Tribe.
Oops, sorry, I was finding my mute. Hello, Nathaniel Brown, Extension Agent down here in Sioux County for Ndsu Extension. Talking about Standing Rock. So we can go to the next slide. Okay. So on Standing Rock, we have a coalition that has been working on some community projects and started a Facebook page for the work that's being done. Good Health Together. The Lakota translation for that is Daya Unjani Pikite. That's kind of a rough way of saying good health together as it translates. But you can go on Facebook and search Facebook/Daya Unjani Pikite. And it has everything, updates that have been going on with the work on Standing Rock here. So a few projects that have been ongoing: hydroponics, community gardening, walking path projects, and physical activity cohort. Next slide. Okay, so with hydroponics, hydroponics, for those that may not know, is alternative gardening method. It's a soilless growing environment. There's a variety of methods that people use to grow food using soilless gardening. Two that we've used is this 27-gallon tote that you see on the right-hand side, and the Tower Gardens, which is an aeroponic method. For hydroponics as well. So with the tote, both setups have water pumps inside. The tote has a PVC line set up inside with holes cut out on the lid, as you can see, and seed pods just rest in those holes there, and the water pump circulates water through those PVC lines and to emitters that spray water and nutrient solution directly to the roots. The same with the Tower Garden. The bottom part of it is a water reservoir where the water pump rests. And that middle tube, there's an inside line that feeds the water up to the top. And there's a shower cap, they call it a shower cap, that'll drip the water down to where on the left picture, you can kind of see where the seed pods sit. It'll be just straight water delivery there too. So it's these are just two methods that we've been using, and our community partner, Standing Rock Community Development Corporation, has done a great job. Ray Moore has been leading that project with SRCDC. These are just some of his pictures that he's taken, stuff that he's grown. Mostly leafy greens is what I've done at my office as well. Ray has done some peppers. I've done a zucchini squash plant before, but the zucchini kind of took over a lot of the tower garden, just because it's just natural ability just to branch out and expand. So, but peppers, leafy greens. I've done tomatoes in a tote. I didn't have so much luck with it, but it's kind of a trial and error for me, because gardening isn't really my background, to be honest. So I'm kind of learning as I'm going along with the work here. So, but it's been, like I said, it's been a good experience. It's been quite a learning experience using this method here, and everything grown. Well, circling back to Standing Rock CDC, Ray Moore, he also has a food distribution initiative at his program there, and all the produce that's grown through the kits is circulated through his initiative as well. So they co-op with Great Plains Food Bank. So when Great Plains Food Bank comes down to do their food distribution, Ray will package and put in whatever fresh produce that he's grown. So that's kind of how it gets distributed to the communities. Excuse me. The next slide, please. So community gardening is one initiative that has been ongoing before I started with NDSU Extension. Sue Isbell was leading a community garden behind our office for, I believe it was 13 years. Correct me if I'm wrong. I see Sue's in here. 13 plus years, I would say. But since that project has been taken over by another program here in the area, there is other locations on Standing Rock, not only just on the North Dakota side, but I mean, we're talking about Sioux County, but the Standing Rock Community Development Corporation, they've done a 100 garden initiative 2 summers ago. And the Mormon Church in the 48th area, that was a partnership that Sue had created. And that's still ongoing. That's being managed by Sunshine Claymore and a few other people. Kathleen Vetter in Porcupine. They have a community garden that's picking up here. Oh, can you hear me okay? Sorry,
Yes.
I got muted. So where did I leave off? Where did you last hear? Porcupine?
Yes.
Rock House. The Rock House is another site in Cannonball that's being led by Pete Red Tomahawk, and the elderly nutrition site in 48 as well. So those are 3 main plots, as well as a number of other community gardens that Standing Rock CDC has done. Before the past couple years, Darren Schauber, I forgot to list him, that's my apologies. Darren Schauber at the Indian Health Service Clinic, he's a dietitian there. He had a garden on site there at the IHS clinic for a number of years, and all his produce was donated to the elderly nutrition site or was circulated back through his food program there, because he's a dietitian and he also oversees the cafeteria there too. So, and as well as the other communities, all the produce is donated back to the communities, whether it's straight delivery or first come first serve basis. So it gets recirculated back. Next slide, please. So the Walking Paths Project, 2 main partners with that. The Sitting Bull College, there was an initial idea of having a pathway from the highway intersection here in 48 to the campus, because there was a natural walking path that students would take like straight diagonal instead of taking this other designated pathway. But we were looking to kind of build around that, although that idea had actually expanded even furthermore because the Cedarville campus was looking to expand and build and create more infrastructure on their campus grounds. So we have a design place and plan that was courtesy of Sunshine Claymore and her team, which has pathways built in to connect the new infrastructure that Cedarville College is looking to build, everything from more student housing to having a wellness center to an aquatic center to staff housing, and also having a bank listed on there. So the design plan has in place like pathways to connect everything, ideas as far as beautification along those pathways, where it's including planting traditional medicines along the way, fruit trees, fruit shrubs, natural windbreaks with the tree line along areas. So that's one project that's been ongoing. The other is with Woju Inc. They are based out of Cannonball, North Dakota. That's led by Steve Sitting Bear and Dave Archambault II. Dave Archambault is a former chairman of Standing Rock 2 terms ago. But they have a pathway project circling around Cannonball, leading up to the border, close to where the No Dapple site was took place. And they have a variety of ideas for their pathway, everything from historical marker highlights, that one in particular that highlights the very first encampment of a Mandan tribe along the Cannonball River, and of course highlighting the No Dapple site and telling the story from Standing Rock's point of view. So also there's a pump station, and we're looking to do a bike share program with them. We have that in place. That's still being formulated and in progress, as well as they were hoping to get a BMX racetrack like on the west end, on the other side of the highway, and also have a buffalo ranch like around that area as well. So a few things with that. So next slide here, please. So from the physical activity point, we had a cohort running from last summer through the end of September, I believe the timeline was. Just had a group of community members that we had signed up, had provided Fitbits for them to utilize, and was hoping to track the progress with their physical activity, how many steps they're taking. Kind of had a challenge with that as well, and also utilized the group to be community scientists, where we used this Our Voice app that helped identify areas that could be highlighted, like pluses, good things that are in the community, and areas that could use improvement, such as the picture here with the playground. The bigger kind of with the yellow slide, that's fairly new, but I mean the surrounding equipment, I mean that could always use an upgrade and improvement. And there's also a couple basketball hoops at that park too that are a little bit rusted that could use some restoration or replacement. Also highlighting, sidewalks that would need repairs, intersections that could use some new paint on the and also some new signage, and also where the community finds where they go to shop, where they find their food. We have the White Buffalo grocery store here in town. That's kind of the main hub, as well as we do have commodity distribution that's led by Charles Gates. And that menu has actually drastically changed. Just a side note on that, they do have a variety of healthy options now with fresh fruit, fresh produce, fresh meat, instead of the canned options. Of course, the cheese, that's always, I'm not sure if or not that will ever be gone. Yeah, I guess it's a safe assumption for Indigenous people that one might be actually be blended into like a cultural thing at some point. A traditional block of cheese. I'm trying to make a joke here. But yeah, so Charles Gates, he's done a tremendous job there, revamping the menu, lobbying at Congress to for better food, for healthier food. So he's done a tremendous job there. Other sites in place. I mean, we have a Family Dollar here as well, and of course the community gardens that are provided each year too. So next slide, please. So looking ahead, a couple things that that are in the works. One in particular is a mural project with Danielle Seawalker. If you Google Danielle Seawalker, you'll find she is a phenomenal artist. She has a lot of great work out there. She's from Standing Rock, and she's looking to come through in August during the 48th powwow, which is like the first weekend in August, to paint 24 murals around the 48th area. And there'll be 24 artists in total, 12 from Danielle's team and 12 local artists to learn and gain experience. With that, and each of those murals, the sites have been picked. And I think here in June, like the early part of June, they're gonna do another site visit to where they'll measure the dimensions and, you know, provide those to the artists, and that way they can get to designing. So when it comes to August, you know, you can just, I think there's like a week and a half time frame to get everything painted and highlighted here. So that's a beautification, from a beautification standpoint, like improving your community that way. So that's one thing moving forward. And so this video was done late summer, last late summer. Is that right?
Sorry.
I'm Nathaniel Brown, Extension Agent for NDSU Extension, Sioux County. I have a dual role, is working with the Family Nutrition Program through NDSU Extension, and then also a CDC grant, Center for Disease Control grant, called the Healthy Outcomes Project, High Obesity Program. With the Family Nutrition Program, it's nutrition curricula, direct education for the community here in Sioux County, and then also with the CDC work is focusing on two elements, coalition building, tribal food sovereignty, improving access to healthier foods, and then also physical activity promotion. With some of the projects focusing with tribal food sovereignty and improving access to healthier foods, we're trying to build back some of the ecosystem that we had historically. And there's another element to that too. When the flooding happened here on Standing Rock, you know, it kind of wiped away a lot of the ecosystem that we'd had. And this is kind of one way to try to bring that back in a sense, where we're planting medicine wheel gardens. We're planting more trees, more fruits, more fruit trees, more fruit shrubs, to try to kind of bring some of that back. We do have a coalition in place. We do have you know, people that are participating with the projects. We have community gardening initiative. We're partnering with local partners, local programs with that initiative. We've worked with Raymore in the past here at Standing Rock CDC with you know, his 100 Garden initiative last year. Hydroponics, which is you know, kind of what we have in the background here. Indoor, outdoor growing, soilless growing environment. We also have a walking path project out at the Sidewalk College that we're partnering with the administration of the college with. Hydroponics was one of the projects that came about, and that was kind of bit off of like community garden initiatives that are ongoing within Standing Rock there. And it was an alternative method because it's a soilless growing environment, being able to grow year round, and you can grow indoor, outdoors, and it's fairly easy to learn.
So the project behind me is called Hydroponics, and it's a water-fed system. And the way it started was me and my friend Nate Brown, we collaborated together through NDSU, and we started this hydroponic system. He told me he had some kits. In return, I said I would like to, you know, learn about hydroponic systems and see what I could do with them. And what I do is I just set them up for throughout the winter, and I grow them throughout the winter, and they produce lettuce, kale, peppers, almost anything. You could grow absolutely anything out of them. So
everything grown that we grew in the hydroponics is all vegetables and healthy living cells, healthy eating. And what we did was everything that we grew, we harvested it and gave it to community members. It's super easy to learn and it's fun. And it's a little bit of time, depending on how many you have, but it's worth it. And it's not difficult at all. And Nate, when I did have questions, or Nate would come over here and just show us what to do. And they're easy to take care of, and they're a lot of fun. Their community gardens and these hydroponics, not only is it healthy eating, if you think about the big picture, if you teach somebody how to grow their own vegetables and things like that, then they could do that for the rest of their lives. You know what I mean? They'll always have that knowledge. And I think that the hydroponics anyway is such a good way to watch it from beginning to end, to harvest it.
Whole hydroponic systems, like when I first started, like I said, only had 3 of them. Now I have like 11 of them. The way it works is we're just trying to collaborate with the schools also, like Sitting Bull College, any of the grant schools here, just to teach these little kids how to grow through hydroponic systems and through a water system. I think that's such a unique thing because our people, we never grown like this. We usually are out in the elements, outdoors, and we grow that way, and that's our traditional way. So hydroponics just brings a whole another level of growing where you can grow throughout the winter months year round. Year round you can just use these systems and just grow all year. So I think that's a really beautiful thing, and to give fresh produce to our people and to people in need, I think that's a great thing. To have that next generation learn about this and I guess maybe take it into the future. I don't know. I think that would be such a great thing for our people. It would just show a different way of growing versus our old ways.
Okay, go ahead, Tanya.
All right, well, hello everyone. Thanks for joining. My name is Tanya Pershin. I am from the Turtle Mountain tribe, as is so my other colleagues too. A little bit of history on the Turtle Mountain tribe is, I guess, a little bit of backstory before we came to be in North Dakota. So we had a great migration west from to follow the 7 prophecies. So originally from more of like the New York area. And then from that, the prophecy had told us that we needed to find the water the food that grew on the water, which is monoman, wild rice. So then doing that, we had migrated west. And then we would stop. And we had found it in Madeline Island, which is also a beautiful place. I recommend that anybody goes there. It's in Wisconsin, and I just love it so much. I'm going back this summer. But so we just decided to keep going. So as you can, like, from Wisconsin or from Michigan to Wisconsin to Minnesota, there's different bands of Anishinaabe tribes that continue going west. And then our tribe, the Turtle Mountain tribe, had been one of those that kept going west and then finally resided in the Turtle Mountains, which was founded by Chief Little Shell. Besides all the like treaties and things like that, this, is our home. We have a 6 by 12 mile reservation. So it is fairly small. And it is north of the North Dakota and Canadian border. So we're about 10 minutes away. So pretty close with that. We have a diverse population, I would say, because we have different mixes of culture. So we have the Anishinaabe people, the Cree, the Métis. So we try to incorporate all those cultures when talking about Turtle Mountain because we are so diverse. We have around 30,000 enrolled members. Not all of them live on our small reservation, though only about 8,000 people live on this reservation. So it is very heavily dense. But that's just how it was founded. And then I just want to quickly point out these nice little banners that we had purchased to put on our light poles, just giving or just highlighting, I guess, our chiefs from the past and just acknowledging and honoring them too. So next slide, please. All right, so the Turtle Mountain Healthy Living Coalition, so that was founded in 2019 to help promote food sovereignty and wellness throughout Rolette County using committees that focus on community assessment, our assets and expertise. So using this platform, we wanted to provide reinforcing tenets, including coalition building, food sovereignty, physical activity, policy development, and adaptation. And overall, our goal is to utilize collective impact to improve community connectivity through a unified communal voice. So we haven't updated this list, but from previous whenever we had checked previously, we had about 49 people that were representing 33 programs within 11 entities that had were in our coalition. So that was a very large number for us, but it continues to grow as we host every monthly coalition. So with that, we have like our committees. So we have communication. So with that, we do a strong presence on social media. We post daily. We have different themes, which Michaela will also talk about. And then we provide monthly newspaper ads that highlight community activities and updates and things like that. So anybody that is a part of our coalition, we'll pay for the ad to help highlight their activities, just so we can get more community involvement and feedback too. And then we have a physical activity cohort or committee, and then that kind of is establishing relationships with like the Turtle Mountain Special Diabetes Program for Indians, the Boys and Girls Club of Turtle Mountain, the Byron Dorgan Youth Wellness Center. And with that, we use it to help promote and add to their programs and organizations. So we just kind of want to help highlight and then add to. We also have relationships with like the transportation department, where we help buy signage to help improve like safe street strategies and good things like that. For the Turtle Mountain Special Diabetes Program for Indians, we helped purchase more bikes to help expand their bike share program to help encourage people to ride bikes in the community. And then also we had added bike racks to everyday destinations, so like gas stations, grocery store, post office, things like that, to make those I guess destinations more accessible. And yeah, so for our gardening, we partnered with organizations like Indian Health Services, the Turtle Mountain Retirement Home, 5th Generation Healing Center, and more to create community gardens that promote food sovereignty and sustainability in Rolette County. And then lastly, we have food sovereignty, so working on modifying and adapting new tribal policies. We're working on a wellness policy right now to include a 30-minute gardening break for their lunch break right now for all tribes, because they have a physical activity policy, but we wanted to help adopt that into more of a wellness to incorporate gardening as well. And then we also have a fall harvest festival, which I'll touch on later, and then also a tribal food a tribal egg code that was recently passed. So that's also great stuff that's being done. Next slide, please. And then Karen Armstrong is going to be talking about gardening. She is our gardening expert.
Well, I wouldn't say expert, but I've been doing it for a lot of years, but every year you learn something new. I work for the NDSU Extension Service, Rolette County, and gardening was seen as something that we'd want to promote from the viewpoint of the coalition. They felt that traditions were not going to be extended down to the younger generation, that the younger generation has lacking skills in gardening, and there is interest among the younger. So trying to find the experts in the community, connect them, working with promoting gardening as a way to secure healthy, nutritious foods for your family, and to promote community wealth by donating produce that grow into the food pantries in the local area. All right, gardening is viewed as a healthy activity. Not only is it involve physical activity, but it can be a social event, and it can impact mental health. Studies have shown that connecting people with plants and growing plants, both in the school setting and in the health system, have been beneficial for individuals. It allows people to be connected with nature, understand nature and themselves. We want to be passing along the traditions of growing and planting, harvesting, and utilizing nutritious foods, and promoting also the food donation that I mentioned. Gardening also helps build the sense of community. If there's community gardens and people are there, it fosters positive relationships among those that are involved. And it also sets the stage for individual achievement. People learn about gardening, they develop their skills, they feel very valued in what they learn, plus what they can contribute to the well-being of others through donations. Next slide, please. The self-healing model is implemented as we try to gather expertise on the local level and connect them with agencies that were interested in developing some garden sites. With the pandemic, it was rather a challenge the last 2 growing seasons, but we did develop demonstration sites so that people could view them from a distance and be encouraged to garden. Sites involved Turtle Mountain Housing, the Turtle Mountain Retirement Home, big effort there. We had 5 different organizations, funding from different sources, pulled together to develop raised beds. And 63 raised beds were shared with the residents at the retirement home. And then the Turtle Mountain High School Honor Society had interest in learning about gardening and connecting with the elders to learn about traditions and just the elders' experience when they were younger of gardening. So the group was brought there. We met first weekly, and then it turned into bi-weekly all summer, and helped with planting the gardens, caring for the gardens, and then visiting with the residents. Because we were limited in social connections, a lot of the visitation was one-on-one, but it was still a positive effect. The Quinton Burdick Indian Health Services developed a small garden outside of or adjacent to their employees' break room. So that was a visual positive thing for the employees in terms of just connecting with nature and relaxing while they were there or visiting the garden. And it was an opportunity to share gardening skills and learning from one another. The Turtle Mountain Boys and Girls Club, we had 2 raised beds there set up as educational tools for programming with youth. The 5th Generation Healthy Healing Center set up 5 raised beds, and they involved their residents in learning gardening skills, seeing gardening as a relaxing hobby and the benefits of it emotionally. And they grew food that they then used in their meals at the center. They also donated to the food pantry. The Rolla Community Garden was set up. It was the first year for it. The picture at the bottom, the middle is a early season shot of the rows of beans being grown there. They produced foods with the intent of just donating them to individuals in the community who would benefit from that. They set up a free produce, Rolla free produce stand, and then through a Facebook developed for that purpose, they promoted the garden and also put blogs on when the vegetables were ready, what vegetables were there, and when they would be available. Pickup was anonymous by any individual who wanted to come by the stand and pick the produce up. So it was reaching people that maybe didn't have access to fresh produce in that manner. And the Turtle Mountain Department of Agriculture did some small demonstration gardens, which are on the far bottom right there. Next slide. These are just some shots of the different gardens. We had a variety of gardens from land-based to raised beds. We had fabric covered, protected soils. We had hand tilling, and then just some examples of things in action. The middle bottom was the high school students when they were mixing the soil and setting up the beds as they were set up. And the community gardening day at Rolla. Next slide, please. Looking at how can we promote gardening, we wanted to do more than just those demonstration gardens. Fall was coming, so we did kind of piggyback on the idea of what Sue Isabel and Nathaniel Brown had been doing in Standy Rock, and found that some schools were interested in being host sites for hydroponic gardens, and gardens are now set up at 9 different schools, and the gardens are being used in a very good fashion. teaching youth about how to grow plants, getting them to think about careers related to food systems, and then doing taste tests of the foods that they grow. And one site coordinator, Allison DeJarlis at the middle school, invited her administration come and share with the meal that they are preparing. So the 2 pictures there of the foods were foods they made for that meal. They made Tuscanini soup with kale in it and fresh greens. And then the bread stick has herbs that they've grown in there to season it. And it was so well received. The administration is now looking to invest. I think they're purchasing 9 more tower gardens because they want more students to have the opportunity to experience gardening, and then also with the idea that they could possibly grow greens that could be utilized in their food service program. Next slide, please.
Thank you so much, Karen. Tanya, back to you.
All right. So we have currently been working with the Turtle Mountain Chippewa Food Pantry. They were a donation site that we have been using for our gardening and for hydroponics. And then Karen Armstrong has also built a really good relationship with them in past years, working with Jackie, who is the director of the pantry. And with that, we had shared a grant opportunity with them, and we decided to apply together because they were in need of a new vehicle to get back and forth between Walmart, as they get their food from Walmart too, to help distribute into the community. So they needed a safe, reliable vehicle. So then we helped apply for that. And so they were awarded 2 different grants from the same place though. So they were awarded a $15,000 emergency funding, as well as a $35,000 Setting the Table grant from the First Nations Development Institute in Colorado. So this grant will support the efforts of transporting food throughout the Turtle Mountains as they do deliver to different homes. They go to the retirement home to help the elders that aren't able to come to the food pantry. So they do a lot of community work as for doing that. And then the project goal is to increase their reach through the expansion of internal resources and infrastructure by establishing a 501c3 status, digitizing their files because they currently only write down their files and then have no like database to enter that into. So I mean, we're just worried about just in case, like if there was a fire or, you know, losing their data, just things like that, because they have been working since, or have been operating since 2007. So, and like I said, we want to help them purchase a new vehicle. And with that, we are going to help, the grant's going to be doing a portion of that. And then we're also partnering with the tribe to help match some of the prices that we are looking at for the vehicle. And then just a little bit of backstory, because the Turtle Mountain Food Pantry, they're rock stars. So all of them are volunteers except for Jackie. She's the only paid one. So a lot of their volunteers are elderly people. And I was able to participate in one of their donations, and it was like in the negatives, and they were outside kind of just distributing out all their food that they had gotten from Walmart. So I mean, they serve over like 9,000 people, enrolled members in Rolette County, and then also all the people that aren't, are 9,000 enrolled members for Turtle Mountain, and then also the 3,000 that are additionally living in Rolette County. So they do serve quite a few people. So they do really great work. So we just kind of wanted to highlight the work that they're doing with that. Next slide, please. All right, so hosting an annual Fall Harvest Festival. So the first Fall Harvest Festival took place in 2020, and it was virtual due to the pandemic. So topics had included like traditions, language, culture, cooking, food preservation, physical activity. And then also in 2020, they had hosted a screening for the film Gather with a panel discussion by the director and 3 featured community members from the film. So that was a really engaging piece that they were able to add for that festival. For the 2021 festival, community members had seemed to be more interested in food sovereignty. So that was a big target. there was 10 presenters that covered a variety of topics that kind of went back to the theme of the 2020. So there were traditional artwork, cooking tutorials, language components, knowledge storytelling, student living, gardening, and then food sovereignty, safe street strategies. And then we had also incorporated a daily contest. So with that, we were able to encourage community members to engage with our posts, and then we were able to compensate if they had won, we were able to compensate them with a gift card of an Indigenous owned business, and also Farrah Rappel had beaded earrings in one of her videos, and she was able to donate that to us. So that was really awesome. One thing that we had learned from our Fall Harvest Festival going virtual is that we had to adjust, which was a new process for all of us. Doing so, though, we were able to reach more people than we could have imagined. The first year there was 14,000 people that we had reached across the whole world. So people in different countries were viewing the video. So that was awesome to see. So we were able to create a repository that allowed us to harvest traditional knowledge and language and culture on our social media platform. And now we have that knowledge and videos on there for anybody to view whenever. So that was a big beneficial plus for us, realizing how awesome it is to go virtual to, or allowing that option to do so. Next slide, please. All right, so moving into the Turtle Mountain Let's Give Physical Cohort Phase 1. So like Nathaniel had mentioned, they had did a cohort. So this was a little snippet of our cohort. So we had 22 community members participate, and they were provided a Fitbit to track their progress, as well as monthly stipend of $150 to kind of document their steps. And then they had to participate in 2 community activities, and then also use the Our Voice app component, which asked them weekly questions for 8 weeks. And then they had to kind of identify what makes it easy or hard to be physically active or eat nutritious foods in the area. And that was just, we'll touch more on that in the next slide. But for this, the community or the cohort members had participated in 30 community events. So they did walk runs, farmers markets, yoga, food preservation workshops, golf leagues. And so they were very active. It was nice to see them, I guess, post and share and encourage others, because we had this private Facebook group. And so they were very encouraging of all the cohort members, and it was a very positive atmosphere. So that was really nice to see. Can we go to the next slide, please? And then here is the importance of the Our Voice data from the questions that we had asked the community members, well, the citizen scientists, as what we also call them, to document the features of the community that impact their ability to lead healthy lives. So like I'd mentioned, we asked them a question per week. So some would be like, what makes it easy or hard to walk, bike to your to get groceries. And then some would say the assets, you can walk to the store for little things. Challenges would be they live out of town, too far of a distance from homes in rural areas. So with the tribe being very spread out and being from a rural area, it is a little bit harder to commute to the town if you live closer to the end of the border of the reservation. So there are some challenges. Other things were walking and pedestrian safety concerns. So there are some crosswalks, but not all crosswalks get to the grocery store. So those are some disadvantages that we were able to, challenges that we were able to collect. And then I guess look at to help motivate the work that we're doing. So looking at some of the big concerns of walking. So we are looking at a safe street strategy. We did a proposal with the Turtle Mountain Community High School, Dr. Shane Martin, and the Community Development Task task force, which is made up of a group of individuals representing different entities. And then with that, they were able to propose sidewalks that would be added throughout the school that kind of do a loop that connects through our fitness center, the Byron Dorgan Youth Wellness Center, and connects all the schools. And then we have a safe walking path that kind of encourages safe walking, and because a lot of our high school students that are in cross country or track also have to run on the highway. So that was also a big priority too. And then adding bike racks, that was also a big motive. So then people could also get into town safely, and then, use the bike racks to store their things. And then beautification efforts we were looking at, because there were some concerns that I guess just the town just needed to just be a little, revamped, just give it a pretty little makeover. I don't know if I'd call it that, but we wanted to look at like painting murals on our community buildings that kind of, I guess, just represent us, or just bring light, happiness, things like that. And then also we did a Tribal Nations Research Group research review board approval. So with that, we were able to look at the data from the research perspective if the community wants it. So right now, we're not doing anything with the data that we had collected, but if the community did want to do something with that, we would definitely move forward, but we do want to keep that option with the community too. So that was a big thing that we also wanted to do, is just make sure that this is really what the community wants, and what how we want to move forward with that. So next slide.
Thank you, Connie.
So during the course of the first 3 years of the grant, we started to notice that the work we were doing through the Turtle Mountain Healthy Living Coalition is very similar to strategies that the Tribal Council wanted to work on or had plans to work on. There's between the work that we were doing within the community and the tribal government system. So the Turtle Mountain Community Development Task Force was formed to address the siloing effect that was occurring. And this allowed us to create a communal approach to the work while providing us the opportunity to leverage the resources and expertise within the group. The task force is comprised of tribal employees from the Economic Development, Community Development, Tourism, Tribal Diabetes Prevention, and Tribal Parks departments. It also includes school representation from the Turtle Mountain Community College and the Turtle Mountain Community Schools. And then Tanya and I serve as coalition representatives within the task force, just to be that connecting piece between the two entities. The Community Development Task Force has kind of invested in streamlining projects that are aimed at improving public safety for students and their families when they're being physically active within the community. To date, we have submitted a Sidewalks Across Campus proposal, which Tanya had mentioned, that's aimed at connecting the Turtle Mountain School campuses to local recreational facilities through the development of a 1.25-mile sidewalk development initiative. We are currently working on a community-wide beautification project aimed at enhancing the natural beauty within our community through infrastructure development that encourages outdoor physical activities. Infrastructure building was an additional step that we need to include due to the political landscape, the effects of the pandemic, and the unique government structure.
Thank you, Jacob. We already saw a great example of Michaelin's communication work with the infographic that Tanya had on her page about the physical activity cohort. So Michaelin, can you tell us more about communication strategies?
Yes, so basically my job is to help incorporate community events within our Facebook posts, newspaper ads that include food sovereignty, physical activity, safe street strategies, and overall healthy living. This could be community gardening, events that are happening in the community, like traditional events like beadwork we've shared. One of the flyers we have in the corner is for our phase 2 challenge for the physical activity cohort. So this challenge is going to be a little bit different, but this will run till September 30th. So I'm excited to see the data for that, although I won't be here very long, but I'm still going to check in and see how that one's went, because it's really interesting looking at the phase 1 data. And then in the right corner is one of our newspaper ads So the Turtle Mountain Healthy Living Coalition partnered with the home visiting program and within the college and distributed 150 books of the Mishominist book to Turtle Mountain home visiting families. So a lot of the pictures, you could see the children as they get their book and their excitement. So it's really fun to see reactions like that within the community. And then we also were able to donate 550 of the monies raised to the food pantry. So if you see the top left corner, there's Tawny and some of the volunteers and Jackie, who's in charge of the food pantry. And then you'll see some of the Turtle Mountain home visiting workers and people from the Turtle Mountain College. And then, so with Facebook, we have a theme for each day during the week. Tawny will do motivational Mondays. So this can do anything wellness context. And then Transit Tuesday is going to be like our safe street strategies. Maybe the weather's really bad that day and they close down some of the roads. Maybe we're sharing things that other tribal communities are doing to ensure safety in their communities. One of the posts that I've shared before was creating more lighting on the highways and roads in tribal communities so it's more visible at night to reduce the amount of fatalities from people walking. So in our community, there's a lot of people who will get hit by vehicles because there's either not enough lighting or there's not enough stop signs and things like that. So with the grant we work with, we want to incorporate these safety strategies to reduce the amount of people getting hurt and mortality. And then Wellness Wednesday, we could use that for pretty much anything. So if it's powwow season, so I recently created a post with all of the powwows in North Dakota almost, and it was a really big hit because a lot of people like to attend those, especially with the nice weather coming. We do 5K runs on these days, we do gardening initiatives on these days, and all kinds of things. So that's fun. TikTok Thursday is similar. Tawny runs TikTok Thursday, so it could be motivational, it could be traditional, cultural. It could be gardening, it could be a new recipe, things like that. And thank goodness it's Friday, Food Friday. Tanya usually shares some really good recipes on Fridays. So it's kind of nice to try to put your cooking hat on during the weekend, but I'm not very good at that, but I'll try anyway. And then the newspaper ads, sometimes we'll have some of the same content from our Facebook. We usually like to put out community announcements, like maybe there's a food distribution going on next week or something, or within the month. So we want to alert the community that that's happening. And that's a really good tool to use. Something we would like to do in the future is to start radio ads. And it'll be a lot similar to our newspaper ads, but just getting it out there for that audience that maybe they don't have Facebook. A lot of the elders listen to the radio. So that's that population we would like to target. Maybe they want to attend a walk run and they don't know about it from Facebook, or maybe they can't get the newspaper because of transportation, but they have a radio at home. So that's one of the things we want to incorporate soon.
Thank you, Michaelan. And I just want to mention, Tanya is one of our current MPH students in our program and is in the American Indian Public Health Subplan. And Michaelan also is a current MPH student in that American Indian Public Health Subplan who graduates next Saturday. So we want to express our appreciation for all his hard work on our project and wish him well. He's going to be continuing to do great work in our area and also be starting a PhD program. So congratulations, Michaelan, and thank you.
Thank you.
This is a really terrific video. It's one of the videos that was produced out of the Fall Harvest Festival 2021. And it's about close to 6 minutes long. So I want to make sure we have time for questions. So I'm going to put this URL in the, or maybe Jacob could do that for me, put it in the chat and invite you to watch this. If we happen to have time at the end, would love to show it. I'm just going to take a moment to talk about part of my role in this project. I take care of the evaluation and performance measure requirements of the CDC HOP grant. And, you know, one of the big questions that we had early on was, you know, how do we define success? And over time, the CDC, became more refined in how they decided to define success. And it's not necessarily consistent with our program's working definition. Our definition of success is our community-driven projects and our engagement piece, the sustainability. We're really excited about things like the enhanced trail system and community beautification. And so things like that do have overlap with what the CDC is looking for in terms of enhancing opportunities for physical activity. And, also with respect to food systems and healthy nutrition standards. But, we always make sure that, what it is that would be consistent with the CDC is something that the community wants. And then we go through kind of the CDC's process of justification of those activities. But they're monitoring the number of new and enhanced places that are providing increased geographic or financial access to healthier foods, and the number of people potentially impacted by that, the number of community sites that are implementing healthy nutrition standards, and that can include venues within those sites, and also the people impacted numerically. And then on the physical activity side, they focus on both the routes and the destinations. So they break it down into potential linear miles, which is when you've gotten policies and plans that have been approved, and then when those have been implemented, the actual linear miles. And their focus is on connecting the everyday destinations, ideally making improved physical activity part of their people's everyday lives. One of the good things about the Our Voice process of using community scientists to collect information was to provide more feedback around some of the CDC's expectations and the feasibility of walking or biking to get groceries in a rural community in January, for example. Destinations, number of potential new and enhanced sites that are connected by activity-friendly routes addressed by newer improved plans or policies, and then those actual sites once those plans have been implemented, and again, people potentially impacted. And then they also had a specified evaluation plan. To what extent have efforts to improve existing programs and systems serving our Indigenous communities led to increased purchasing of healthier foods? And to what extent have our collaborative efforts to connect activity-friendly routes to everyday destinations led to increased physical activity with an emphasis on walking? And so part of our assessment process is looking at the amount of fruits and vegetables then that are purchased through SNAP at farmers markets, and the number of pounds of fruits and vegetables that are distributed, which is a proxy measure when there isn't always an emphasis on selling that produce. And then looking at active transportation, and specifically looking at active transportation to schools and to retail grocery stores. And that's where a lot of the Safe Streets efforts are going to be measured in that evaluation question. And then I'm going to take a moment to talk about some of our lessons learned and the importance of relationships to our work moving forward just can't be overstated. And so both Nathaniel and Tanya are extension agents that have been hired through this grant and are from their local communities. And so they come with the abundance of the relationships and history they have in their own communities. It's been great to be able to have Michaelan on this project, and Jacob as well. Also bringing a lot of relationships with them into the work. And then, the rest of us continue to build our relationships. And then people like Karen Armstrong, who've been fixtures in the extension community in Rolette and Sioux Isbell in Sioux County, have had lots of long-standing relationships. As we noted, the CDC funding was basically restricted to big land grant institutions like NDSU across the nation. And so we have worked to invest as many of the resources directly in each community as we can in terms of like subcontracts with the Standing Rock Community Development Corporation and purchasing these hydroponic kits for the schools in Turtle Mountain, lots of different areas that we work to get those resources invested into the communities. We really pulling together really diverse expertise areas, and that's been really helpful and beneficial. As I mentioned, building on our programs and relationships within Extension, which really is the focus of the HOP acronym funding stream. And then we did really have to pivot with the COVID-19 pandemic. That started basically partway into our second year, and we had lots of community engagement activities planned. And so that transition from in-person to Zoom was really successful in a lot of ways, getting more people engaged in Facebook as a platform, and that ability for people to watch the Fall Harvest Festival activities sort of on their own time, that reduces barriers of transportation, etc. We do run into Zoom fatigue, and are definitely looking forward to a combination of both continuing the online aspects as well as more face-to-face interactions again. And our community priorities really did shift with the pandemic. For example, the first newspaper ad that we ran was about all the upcoming distribution dates and places that food was being distributed, some of the programs and due dates for expansion of SNAP and requirements for WIC, etc. A lot of the work that we had planned at that point related to transportation was basically put on hold for the next 18 months. It just wasn't the priority for the community at that time. And then there's been a huge influx of money, which it's wonderful for there to be all those resources, the CARES Act funds, the ARPA funds, tremendous investment in the community. It's actually kind of hard for the communities to get all this money spent within the federal government's timeline. And so working with the funding aspect of our grant has been less of a pressing priority, but we really have continued to make good progress. It's really important that we've continued to be adaptable to the changing course and to internal and external partners as necessary, really being responsive to the needs of the community. And sometimes the bureaucratic processes are not always as adaptable or as quickly adaptable. And we have had some challenges with respect to community relationships, which are really our gold standard. Like, nothing, we don't want anything to damage our community relationships, especially for our partners on this project. And so, needing to be flexible and sort of responsive to the emerging community priorities can be difficult for established bureaucracies like NDSU and CDC. So sometimes it's, we've had position turnover in a lot of different aspects of the grant, and sort of clarity in like what are the policies to get our newspaper ads paid for and reimbursed, to get our cohort members paid for the physical activity cohort, or maybe sometimes the CDC is happy, with the justification we've given, but NDSU needs more. And then the CDC has had turnover in their leadership positions too, and that has caused some bottlenecks in terms of timeliness and responding to some of our requests for specific permissions. And then I think one of my biggest pieces has been balancing the CDC HOP expectations around performance measures and evaluations with what the community actually needs. We do a lot of framing around how the things that the community wants fit into the CDC's guidelines. Like they maybe hadn't thought of community beautification as really helping enhance physical activity. And it's really about making that, celebration of culture and artists, making, positive spaces for people to want to be engaging in. And then even just, sort of that partnering with a land grant, considering the history of the land grant, and just how, as Megan had mentioned in the beginning, just really recognizing, some of that history and where some of the privileges there. Really important to have the right people in the right positions that are passionate about the work, and that really helps us move forward. And Michaelan is going to speak briefly on some of our best practices.
So it is important to know that approaching a tribal community would be completely different than approaching the city of Fargo. So you have to understand that there's a culturally tailored approach, and understanding the importance of family, where the community is seen as a family, recognizing that all communities are different from each other, not one is the same, ensuring a safe space to build relationships of trust and transparency. So that's kind of what Ramona talked about, is making sure that we're paying our newspaper on time. I had an issue last summer with my practicum. We promised community members in Turtle Mountain that there were elders that we would give them a gift card. So they thought it would be a physical gift card. This was for a completely different project. Nothing with CDC HOP, but it's just an example. So these elders thought that once they were interviewed, they were going to get a gift card. Well, NDSU actually made it to where they wouldn't get the gift card right away. It was going to be emailed. And so there was like a miscommunication. So they're wondering, like, where's their money for doing the interview? And I actually had to like keep contacting to finally get them their money. So things like that are gonna break trust relationships with people in the community. They're not gonna want to do the survey again if that happens, you know. So they're expecting these promises, and it's hard to break them and ensure that there's still going to be that relationship there. Using traditional knowledge and Indigenous ways of knowing, incorporating and promoting cultural and traditional healing community activities. So a lot of our Facebook posts and things that we share, community involved, and we like to incorporate culturally tailored things. Like yesterday, Tanya shared a murdered and missing Indigenous women post, TikTok for our TikTok Thursday, and just embracing the culture and making sure that voices are recognized.
Thank you, Michaelan. And maybe we'll open it up for questions now, Tanya, and I'll just show these two slides with some great resources. And if there aren't questions, we can tell you a little bit more about them, but this is some of the recommended reading. And we have one more slide on some recommended watching and listening. But let's open it up for at least a few minutes of questions. And I see that Jacob has been putting some links and comments and resources in the chat. So check that out if you haven't seen that yet.
Yeah, so please feel free to unmute yourselves if you had any questions. I should say there was a question earlier from Terry Martin Parisian. She had a question for Tanya and Nathaniel. She said that you both noted the need for sidewalks, both repairs to existing and new construction. As I'm trying to be mindful of the environment, I'm wondering if there have been discussions to alternatives to cement for these projects. And I know Jacob had mentioned that they had discussed natural pathways as an option. Wasn't sure if any of the other team members had any comments on that.
I know that this might not have been something that we had discussed further, but I know that other tribes right now, I think it was Winona Ladue, is looking at doing hemp for like concrete. And I know that the tribe is now in production with hemp. So then that is also like an option to potentially use hemp concrete for sidewalks, but we haven't like talked any further about doing that. We more or less focus more on permaculture designs, adding that into sidewalks.
Thank you. That's so interesting. Hemp. I wouldn't even have thought that that would be possible, but.
Yeah, same. So it's awesome.
Other questions, feel free to unmute yourself. And yes, Jacob, your team does rock.
We're sorry we went a little long. We couldn't exactly time ourselves, and clearly we're excited about our work. And
Ramona, would it be possible for you to make a list of these resources, and that could be made available potentially to the people who've joined us today if they're interested in those, just so that they don't miss out on these resources?
Absolutely, be happy to. Here's the recommended watching and listening too.
Awesome. Feel free to unmute yourselves. Any questions? Also, I should mention, Ramona and team, if anybody does have any questions, because we're running down on time, can they contact you directly?
They absolutely can. Megan and Jacob are great resources. You could contact any of us directly, but those are the emails that I gave here. And anyone who knows me is welcome to reach out to me directly as well.
Okay, I should say, I've learned so much. Thank you so much to the CDC HOP team. This was such incredible information. You're doing a lot of great work. We just want to thank you so much for sharing this. And thank you all of you for joining us today.